Hello students, welcome to Read Med Prep Academy channel. Today we are going to discuss regarding human reproduction part 6. In this part we are going to discuss about menstrual cycle. What is the menstrual cycle? It is otherwise called ovarian cycle. It occurs approximately once in every 28 or 29 days in a female during the reproductive life, from menarche to menopause, except during pregnancy. What is menarche? The first time menstruation that occurs in a girl at the time of puberty is called menarche. What is menopause? It is a stoppage of menstruation after the reproductive life at the age of 45 to 50 years. Normally, when we take the menstrual cycle, the first day is the day of the menses. After that, after the fifth day, is the proliferative stage. After that is the fertility phase, then the luteal phase. The cycle of events starting from one menstrual period to the next menstrual period is called the menstrual cycle, during which cyclic changes occur, where in the ovary, in the uterus, and also in the hormones. What happens usually in the uterus? The thick lining of the uterus, called the endometrium, is shed during menstrual cycle. The cyclic menstruation in a woman is an indicator of the normal reproductive phase. What are the phases of the menstrual cycle? Number 1 is the menstrual phase. Number 2 is the follicular or the proliferative phase. Number 3 is the ovulatory phase. Number 4 is the luteal or the secretory phase. Normally, we see that these 4 phases occur once in every 28 or 29 days. In the menstrual phase, what happens? The cycle starts with the menstrual phase when the menstrual flow occurs, which lasts for about 3 to 5 days. The first day of the menstrual bleeding is the first day of the new cycle. Menstrual flow is due to the breakdown of the endometrial lining of the uterus and its blood vessels due to a decline in the level of the progesterone and estrogen. FSH and LH is also low and oxytocin is high. You can see in this chart in the period, the proliferative phase and the secretory phase. Menstruation occurs only if the released ovum is not fertilized. If it's fertilized, there will be no menstrual flow. A period is a release of blood from the girl's uterus. How does it come out? It comes out through her vagina. What does the menstrual flow contain? It contains blood. How much quantity? 20 to 80 ml of blood is shed. What does it contain? It contains RBCs and lot of mineral salts like calcium, potassium, magnesium, etc. And the degraded endometrial tissue. From where? From the uterine lining. It also contains the remnants of the unfertilized egg and some quantity of cervical mucus and vaginal secretions. Absence of menstruation, or if menstruation does not occur, it's an indication of pregnancy. However, in some females, it may also be due to stress or hormonal disorders or anemia. What happens in the second phase, the follicular phase or the proliferative phase? The proliferative phase or the follicular phase extends from the 5th day to the 14th day of the cycle, until the time of ovulation. We can see that there are changes in the ovary as well as in the uterus and the changes in the hormones. This period is called the pre-ovulatory period. What are the changes that occur in the ovary? During this phase, the primary follicle, which was less than 5 mm in the ovary, grows and matures itself to form a Graafian follicle. And what is the size of the Graafian follicle? It is around 20 mm size by the 14th day. We can see in the chart that a lesser, smaller follicle, which is about less than 5 millimeter, slowly increases till the 14th day to about 20 millimeter. What are the changes that occur in the uterus? Ovarian changes are simultaneously accompanied by changes in the endometrium, which regenerates and proliferates. All the glands are become twisted and increased and tortuous. The blood vessels also increase. The endometrial thickness, which was about 1 to 2 millimeter during the menstrual period or menstrual time, it becomes around 5 to 7 millimeter. And at the time of ovulation, it peaks to 9 millimeter. The uterus prepares itself for what? For the implantation of the fertilized egg. We can see the menstrual phase in this diagram, and in proliferative phase you can see the tortuosity of the blood vessels as well as the development of the glands in the endometrium. What are the changes in the ovary and the uterus induced by? They are induced by the secretion of gonadotropins. Where are the gonadotropins secreted? In the anterior pituitary. What are the gonadotropins that are secreted? The FSH and the LH. FSH means follicle stimulating hormone and LH is luteinizing hormone. The hormones slowly increase gradually during the follicular phase. You can see in the chart how there is a slow rise in the hormones of FSH and LH. It stimulates the follicular development and the secretion of the estrogen by the follicular cells. There is no increase in the secretion of progesterone. You can see in the chart above. In the ovulatory phase, what happens? Both LH and FSH attain the peak level in the middle of the cycle. This is the middle of the cycle. And the LH is very high in the concentration. This is called LH surge. What does LH surge do? This causes the release of the ovum from the Graafian follicle. And this also stimulates the excess secretion of the estrogen, which is also in maximum level. There is no increase in the progesterone secretion. LH surge causes the release of the ovum or the secondary oocyte from the ovary, and this is released into the peritoneal cavity. The process of the release of the ovum from the Graafian follicle is called ovulation. When does it occur? On the 14th day of the menstrual cycle. You can see how the mature Graafian follicle develops and ruptures on the 14th day to release the ovum. Now, next stage is the luteal stage or the secretory phase. What happens in this? It is called post-ovulatory phase. In this, the ovarian changes occur as well as the uterine changes occur. What are the changes in the ovary? After the release of the ovum, in the absence of fertilization, the remnant follicular cells in the Graafian follicle, they become yellow colored cells and they are called corpus luteum. And these cells slowly degenerate and become the corpus albicans, which is nothing but a scar tissue. You can see how a corpus luteum becomes a corpus albicans, which is inactive. Now, what are the uterine changes that occur? The uterine wall secretes lot of nutritionous fluid in the uterus for the fetus, so that this phase is called secretory phase. This phase is called secretory phase. At the end of the luteal phase, there is disintegration of the endometrium, that is separation of the endometrium from the uterus, leading to menstruation, and this starts the next cycle. During pregnancy, all the events of the menstrual cycle stop and there is no menstruation. What are the hormonal changes that occur in the luteal phase? After LH surge, there is a fall in the LH, that is luteinizing hormone. FS also falls, but at the end of the luteal phase, it slowly rises. What happens to the estrogen and progesterone? Estrogen slowly rises in the middle of the luteal phase. Progesterone is to the maximum. Why? Because the corpus luteum secretes lot of progesterone, and this occurs in the middle of the luteal phase. The summation of events, what happens? First there is menses, then the development of the Graafian follicle slowly during the follicular phase, and ovulation on the 14th day, followed by the development of the corpus luteum, then the formation of the corpus albicans, then the start of the next menstrual cycle. What happens in the uterus? The summation, there is menses, there is proliferation of the glands, blood vessels, endometrial tissue during the follicular phase, followed by ovulatory changes, and the uterus is prepared to receive the fertilized ovum. If the ovum is not received, slowly there is secretion of the glands from the endometrium in the luteal phase, and again the separation of the endometrium and disintegration of the unfertilized ovum and causation of next menses. So what happens again? The follicles release the estrogen. This estrogen causes the uterine wall to thicken. What happens in ovulation? There is rupture of the Graafian follicle, release of the ovum, and formation of the corpus luteum, and excessive production of the progesterone. What happens in the luteal phase? Progesterone and estrogen are released from the corpus luteum, and there is thickening of the endometrium. In the menstruation time, the endometrium is separated or sloughed off from the body of the uterus, and the corpus luteum degenerates and forms the corpus albicans, and a new cycle begins once again. So we must understand the hormonal summation in this diagram. The estrogen slowly maintains itself and rises, again falls. There is LS surge, there is FSH surge, and progesterone formation occurs excessively during the luteal phase. Now, what is this polycystic ovarian syndrome? It's a complex endocrine system disorder. It affects women in the reproductive age group, where there are formation of number of cysts in the ovary. It also causes infertility in females, or sometimes there are partially formed follicles on the ovaries, or sometimes the eggs is not properly formed and the eggs do not grow to maturity. So there is affection of fertility. The ovary of a woman with polycystic ovaries have many cysts on the ovary. What are symptoms that the patient experience? There are irregular menstrual periods, increased androgen levels, excessive hair on the face or the body, that's called hirsutism, acne, obesity, reduced fertility, and sometimes there is increased risk of diabetes mellitus. You can see the summation of the clinical manifestations: acne, blackening of the skin, acanthosis, hirsutism, obesity, irregular menstrual periods, hair loss, and infertility. What is the treatment? There is no specific treatment. A healthy lifestyle is very important. Weight loss to prevent obesity, and targeted hormonal therapy to prevent the formation of cysts. Now, after seeing about the menstrual cycle, let us discuss about how to maintain menstrual hygiene. Menstruation is a natural process in a woman, and it is a part of woman's health. It is vital for the good health, well-being, as well as for empowerment and productivity of women. The world celebrates Menstrual Hygiene Day on 28th May. Approximately 70% of all reproductive diseases in India are caused by poor menstrual hygiene. The impact of poor menstrual hygiene on the girls: they become stressed out, they have fear, they have an anxiety, they have embarrassment during menstruation. So what happens? They become inactive during such periods. So they absent themselves from the schools or adults from work. 23% of the girls drop out of schools because of the menstruation once they attain puberty. So Most women in India often use such things as old rags, unclean clothes, leaves, and even ash during the menstruation period to clean the genital area. What material should be used during menstruation? Clean and safe absorbable cloth materials, sanitary napkins, pads, tampons, and menstrual cups. They should be used to manage the menstruation to overcome the menstrual flow. Changing sanitary material should be done once in 4 to 6 hours or as per the requirement of the individual. It provides comfort, cleanliness, and protection from infections. It also helps in increasing the quality of life of women during the time of period. Here we can see the summation of the menstrual hygiene. What should a woman do? The woman should change the sanitary napkin once in 4 to 6 hours, wash her undergarments regularly, keep herself clean, discard the sanitary napkin in a proper manner, wear a clean and dry undergarments. A napkin making machine which was manufactured for the first time in the world was made by Arunachalam Muruganandam. This was done to provide sanitary napkins to all the people at a minimal cost, particularly to the poor women across the country, especially in rural areas. The invention of this sanitary napkin low-cost machine has made a social impact by creating more livelihoods and improving the menstrual hygiene of rural women. He was awarded the Padma Shri in 2016. Now let us discuss how to dispose the sanitary napkin. Used sanitary napkin should be first wrapped in a paper and disposed. It should be thrown in the proper dustbins. It should not be thrown in open areas or drain pipes or toilets, because the flushing of these napkins can clog or choke the drainage pipes and also the drainage line, leading to the overflow of the drainage in domestic and public places. Such problems can lead to water pollution. So how to dispose the sanitary napkin? First, wrap the napkin in a paper, put it in a dustbin and close the lid. Don't dispose the napkin in the drainage pipes or in the flushes. Eco-friendly way of disposing the napkin is by incinerators. Lot of incinerators are being installed in public places so that the napkin can be disposed in a proper manner, particularly in the washrooms of schools, colleges and public facilities. What is menopause? It is a phase of woman's life when the ovulation and menstruation stops. Normally, what is the age of menopause? It is around 45 to 50 years. Why menopause occurs? Because of the end of the reproductive life, there is decrease in the levels of the hormones like estrogen. It indicates permanent cessation of the primary functions of the ovaries. That means after menopause, the primary glands become atrophic. The woman becomes infertile after menopause. You can see the symptoms of menopause: dry eyes, irregular menstruation and stoppage of menstruation, reduced libido, sleep disorders, tiredness or fatigue, hot flushes, weight increase, frequent urination will be there, changes in mood or mood swings. So these are the symptoms of menopause. So we have come to the end of this lecture. Thank you very much. Kindly subscribe, like, share and comment our channel Read MedPrep Academy. Don't forget to log on to www.readmedprepacademy.com. Our Facebook ID is Read MedPrep Academy. Kindly post your questions in the comment box. We will reply the answers for your questions. Thank you.